All right. Good evening, everyone. You're welcome to this class. And let me know if you can hear me from your hand over there. Just let me know if you can hear me. If you can hear me, can you just say that in the comment section that you can hear me? If you can hear me, let me know in the comment section. Yes, just let me know if you can hear me clearly in the comment section. Just let me know if you can hear me in the comment section. Oh, clear. Someone said I can't hear you clearly. Oh, we can hear you. Thank you. Thank you. If you can hear me clearly, just let me know in the comment section. Just let me know. Please call others' attention to that we've started the class already, so that we can all participate and get one things or the other in the class. Okay. Active, sir. Okay, thank you, Lawal. Thank you, Lawal. Who is there again? Just let me know if you can hear me. That's what I want to know. If you can hear me clearly, just let me know. Just let me know if you can hear me clearly. And of course, this is a live section, and it will be put down immediately after the class because it's mainly for those that are serious to join us, and it's just to check us and know how far we have gone with the class. Okay, thank you, Anita. Thank you, Anita. Thank you. I can hear you clearly. Okay, thank you. I've not seen your GG, the GG course it. I've not seen you. Yes, we can hear you. Thank you. Just give me a few minutes, just a minute. All right, so just want to confirm if you can hear me clearly. Yes, that's fine. Let's wait for others to join us. And if you have any of these, you can also send it to them in other colleges. Let them also join us here. Yes, I know you can hear me. Yes, I know you can hear me. So without wasting much of our time, I will quickly run you through the outline again. Let me run you through the outline. so that we can just know where we are coming from. Let me run you through the outline. Of course, in our own class, and I'm sure in other colleges' class too, we start the class with introduction to what we call special education. From there, we'll move to meaning, scope, and objective of special education. Then thereafter, we'll move to the key concept, what we mean by disability, impairment, handicap. Of course, like now, if I talk about any impairment, be it visual impairment or hearing impairment, you should know what impairment means by now. So we talk about categories of learner with special needs. We move away from there, we discuss about importance of special education in society. We move on to historical development of special education. Then we leave here, we also move to global evolution of special education. Then from there, we move on to development of special education in Nigeria. We move away, we move to key policies and milestones, shift from segregation to inclusion. Then we move from inclusive education. Of course, by now, when you hear the word inclusive, the literary meaning alone should give you a better understanding that when we talk about inclusive, it's actually talking about where you allow all learners, irrespective of their learning ability, to be in the same classroom together. That's inclusive education. So we look at the concept and principles of inclusive education. We move on to models of inclusion. We move on to benefits and challenges of inclusion. Then we move away there. We move on to the roles of teachers in inclusive classroom. Of course, I give you the reason why you as a teacher in training, especially in the University of Education, the reason why you need to know more about special education, because these days we operate what we call inclusive education in Nigeria. So in your own class, where you'll be teaching, where you'll be observing your teaching practice, by the time you get to 400 level, you'll be seeing children with different special needs. You see children with hearing impairment, with visual impairment, and the likes, and you just have to take them together. Those are the main reasons why you have to participate in this class. So we talk about learners with visual and hearing impairment, characteristics of visual impairment. We move away from there, we move on to educational strategies for visual impairment. We move on to hearing impairment, the types of hearing impairment, the causes, the communication method. That's where we talk about sign language, lips reading, and then both sign and the lips reading. We talk about that one. We talk about intellectual and developmental disability. And that's where we stop our class. So far, so good. We have been able to cover almost 70% of the class. And this evening as well, we just want to quickly run through a kind of revision. Please, can you hear me? I can see some people saying I can't hear you again. Please, can you still hear me? Please, Lawal, can you hear me? Can you hear me now, Lawal? Lawal, can you hear me? I can hear me, please. Can you hear me? If you can hear me, can you just talk to me in the comment section? Okay, Ifeoluwa, thank you. Alalade said, okay, we can hear you, sir. Thank you. So those are the outline of the course. So we quickly want to see just in summary all what those classes is all about. I will just touch them one by one, one after the other. Then thereafter, we'll quickly run through some questions. We run through questions, likely questions. I didn't say those are the questions that will come out in your test, but those are the likely questions that you are expected to face in exam or in the test. So I'll quickly run you through those things now. Then, so like I said, we start the class with what is special education, and we said special education refer to a form of education designed to meet the unique needs of learner. Special education refer to a form of education designed to meet the unique needs of learner who have disability or exceptional ability. So that means when you are actually talking about special education, you are actually referring to two separate students. Those are the learners with disability and learners with exceptional ability. So that means mathematically, like I said, some of you that know me as math teacher, we move from negative infinity to positive infinity. That is from nothing to extremely brilliant student. That is what special education is all about. It is a form of education designed to meet the unique needs of learners who have ability or exceptional ability. So it involves adopting teaching method, materials, learning environment to ensure that all learners can achieve their full potential, irrespective of their learning ability, whether they have a learning difficulty or they are exceptional good. And that is why I said the essence why this is involved is because by the time you go to your teaching practice, in a class, you will see students that when you say what is 2 times 2, they will tell you 22. And that is where you'll be seeing students that you say, oh, what is 2 multiplied by 2? And they will give you correct answer. Even before you say it, they can even say auntie or uncle. We even know 3 multiplied by 3. We know 4 multiplied by 4. We know 5 multiplied by 5 before you get there. Those are the exceptional students in the class. And you have to carry all of them along in your class. So, like I said, there are scope of special education, which include identification and assessment of learners with special needs. So, as a teacher or as a teacher in training, you must first of all know how to identify those children with special needs. We call all of them children with special needs. If it is children that has learning difficulty, they are special students. If it is student that has that are exceptionally good, they are also special students. So another scope of special education is the provision of specialized teaching method. So you have to devise a special teaching method in handling those students. So we also talk about the uses of assistive devices. Like if some of you that have been to, if you have been to school with special needs, you see them using Braille. It's like a cane like this, white cane. That's what will be showing them where to go and what to do. And some of them even use hearing aids. You see them putting on something that look like headset. They are all hearing aids. That one is for children that has hearing impairment. So they will be using hearing aids. And those that did not have, those that has sight issue, will be using Braille. So in your exam, when you see the word like Braille and or hearing aid, you know that hearing aid is actually meant for children with hearing impairment, and Braille is also for the children with visual issue. So another scope is inclusive education practices. Then the last one is the rehabilitation and support services for them. So with that is that about the concept of special education. Then when we said those are the scope of special education, but let's quickly run through the key concepts in special education. When you talk about key concepts in special education, you'll be talking about impairment. In all your classes in special education, you'll be hearing the word impairment. What does it mean when we say impairment? What does it mean when we say impairment? Impairment refers to any loss or abnormality in body structure or function. Whenever someone is having a loss or they are having abnormality in body structure or function, that is what we refer to as impairment. So when we talk about loss of vision, that is an impairment. That person is having a deficiency in sight issue. Then it could also be hearing loss. That person may not, probably is hearing what is it called? He could hear sound little by little, not in a normal way. That's an impairment. Then it can also be in form of physical deformity. Maybe loss of leg or paralyzed. Maybe the leg is paralyzed, or they are having what is called hand broke, or a physical deformity. When you see somebody that is the body structure, when you look at the physique of that person, you can see that, oh, something is wrong with the leg of this person. something is wrong with the hand of this person. So that is a physical deformity. So those are the three examples of impairment. It could be loss of vision, or hearing loss, or physical deformity. So that is hearing impairment. Then that is impairment. Then we also hear the word like disability. The first one is impairment. The second one is disability. So what does it mean when we say disability? Disability refers to restriction or lack of ability to perform an activity in a normal way due to impairment. You know, when we say impairment, simply means loss or abnormality in body structure or function. So disability simply means, you know, a kind of restriction or lack of ability to perform activity in a normal way due to impairment. And when we talk about impairment, impairment could be loss of vision, it could be hearing loss, it could be physical deformity. So an examples of disability could be difficulty in walking. Someone that is having difficulty in walking now, that is disability. It could be inability to hear properly, or learning difficulty. When someone is having learning difficulty, that is disability. So making two scope of special education. The third scope of special education is handicap. Handicap refers to disadvantage a person experience in a society as a result of either impairment or disability. And examples of handicap is inability to attend school due to lack of facility, or social exclusion, or limited job opportunity. Those are the handicap. Those are the words when they say that person is financially handicapped. Those are the Nigerian manipulated English. They will say somebody is financially handicapped. That means that person is not capable or is not financially buoyant. So that's also referred to an handicap. Handicap refers to disadvantage a person experience in a society as a result of either, so in special education now, it's actually as a result of impairment or disability. That is what we mean by handicap in this place. So the third one is we talk about, okay, let's quickly run through categories of learners with special needs. So we have categories of learners with special needs. We have the visual impairment. Of course, by now, when you hear the word visual, yes, it's talking about, it's dealing with sight. So don't forget that when you talk about impairment simply means what? When you talk about impairment simply means what? Can somebody tell me what impairments mean? In comment section, can you tell me what impairment mean? Impairment. So let's look at the three scope. Can you tell me the three scope? Impairment, disability, handicap. What does the three mean to you in your own language? In your own language, can you tell me? Tell me can you just give me in your own language what are the three? Impairment, handicap, and disability. Give me in the comment section. Can you tell me in your own language? In your own language. In your own language, the three concepts in special education. Impairment, what does it mean to you? So let me see your comment in the comment section. Impairment, disability, and handicap. Handicap. Can we hear? Let me get something in the comment section. Handicap. I'll just give you an example that somebody says is financially handicapped. Thank you, Fabi. Fabi said impairment is any loss or abnormalities in the structure or functions of the body. Thank you. Okay, why handicap refer to no substitute? Okay, somebody is saying impairment is the loss or ability in the body structure. Oh, they are all right. You are all right. You are all right. So I just want to know if you guys are following me. I just want to know if you guys are following me. So let me quickly run you. So on that, we are done with that of we're done with okay. So let me talk about the categories of learners with special needs now. So what are the categories of learners you can see in an inclusive classroom? The categories of learners you can see in an inclusive classroom, or we say in Nigerian classroom, because don't forget we run inclusive education. So we don't separate learners with special needs. We put all of them together. So what are the categories of learners can you see in the class? Learners with visual impairments. So when we talk about visual impairment, what does it mean? Okay, let me just run you through those children you can see in Nigerian classroom or in an inclusive classroom. Learners with visual impairment, that's number one. Learners with hearing impairment, learners with physical disability, then learners with intellectual disability, then learners with learning disability. Then we talk about emotional or behavioral disorder or autism spectrum disorder. I talk about autism spectrum disorder. And the eighth one is gifted or talented learners. Gifted or talented learners. Can I take that again? The categories of learners you can see. Categories of learners you can see in Nigerian classroom. Categories of learners you can see in Nigerian classroom or in an inclusive classroom. What are they? Can you join me in the comment section? Visual impairment. Those are the learners that has sight issue. Those are the learners that have sight issue. Okay. Learners with hearing impairment. Those are the ones that has to do with either deaf or hard of hearing. They are having hearing issue. They have hearing issue. They are having hearing issue. So number 3 is physical disability. Physical disability. Those are those ones that has paralysis. Maybe they have issue with their legs. They're having issue with their legs. They're having issue with their legs. So that's number 3. Number 4 is intellectual disability. Intellectual disability. Those are the children that have difficulty in reasoning or in solving problem. Making 4. Number 5, learning disability. Learning disability. This is affecting this affects academic skill. You know, there's difference between intellectual disability and learning disability. Intellectual disability, that one is difficult in reasoning. They can't reason. But learners with learning disability, that one is affecting those are the children with reading difficulty, or they have phobia for mathematics. We call that one dyscalculia. Dyscalculia. Children with the has math phobia, we call them dyscalculia. Why those one with reading difficulty is called dyslexia. So making how many? That's making 5. The 6th one is emotional or behavioral disorder. Emotional or behavioral. Those are the learners that show aggression in the class, anxiety and withdrawal. Before you say little things like that, they will keep moody. They will not talk to their classmates again. In fact, the children of this day, they can even keep malice with the teacher. They just said, "I'm not listening to his or her class." Those are the children with emotional or behavioral disorder. Then we have autism spectrum disorder. Those are the children that has a learning difficulties in communication or repetitive behavior. What they do yesterday is the same thing. Whatever you correct them on today is the same thing they will repeat tomorrow. Then the last one are the gifted and talented learners. The gifted and talented learner. These learners, they have intellectual ability. They have exceptional skill. When you ask them to do anything, they will do it perfectly. Those ones are categorized as gifted or talented learners. So can I have in the comment section the 8, can I have in the comment section those 8 learners with special needs? Can you list them for me in the comment section? In the comment section. No, resistant is not among go. Okay, someone is, don't put them one by one. Just take your time to list those 8 for me. List those 8 for me in the comment section. List those 8 for me in the comment section. I'm waiting for you. List those 8 for me. Visual impairment. Can you go on? Can you go on? I'm waiting for you. Can you tell me more? Can you tell me more? Can you tell me? Can you tell me? Can you tell me? I'm waiting for you. Okay, learning disability. Someone is listing Bradley hearing aids. No. I'm talking about those things. I want you to list those 8 learners with special needs. So I want you to list them for me. I want you to list them for me. All right, thank you. Light. Yes, that's what I want to hear. Visual impairment, hearing impairment, physical disability, intellectual disability. Yes, emotional and behavioral disorder. All right, thank you. Gifted and talented learners. Yes, those are those things I want to hear. Okay, so let's take it away from there and I'll move on to the next things on the outline. This is just a revision. Like I said, then this is just a revision. So we just run through some of these things. Okay, so let's move on to inclusive education. When we talk about inclusive education, what does it mean? I've said that at the beginning of the class. What does it mean when we say inclusive? It's just like for my years as a math teacher, I always tell them when we say something is inclusive, exclusive. Inclusive means you must be among. It's just like when you said include this, exclude this. Include means it must be among. All together. That's inclusive. All together. So from the word inclusive education, it refers to an educational approach where all learners, regardless of their physical, intellectual, social, emotional, linguistic difference, are educated together in the same classroom with appropriate support system. That's what we mean by inclusive education. It means both the one that is having sight issue, the one that is having learning difficulty, the one that is talented and gifted, they must be in the same classroom. When they are all in the same classroom, you are operating what we call inclusive education. So inclusive education refers to an educational approach where all learners, regardless of their intellectual, physical, social, emotional, or linguistic differences, are educated together in the same classroom with appropriate support. That is what we refer to as what? Inclusive education. So inclusive education is actually emphasizing on equal access to education, participation of all learners, and removals of barrier to learning. That's inclusive education. So that's what we refer to as what? Inclusive education. So what are the benefits of inclusive education? It promotes social interaction and empathy. You know, you will not say you get into the class and you saw one child, apology to those people that did not understand Yoruba, is splitting. Or you saw a child that could not move hand very well. And you're like, why are you writing like this? You have to, feel empathy. Allow that child to feel among in the class. I had an experience when I was in the US classroom. I was so fortunate to once teach in US. And when I got to that class, in a normal class here, it's just like when I got into the class and I met a learners with special needs. And I said, oh, you look like a queen. You look like a king. Can I have your crown? That's the cap that I put on. And I was like, you wanted to take my cap. And in Nigeria here, or in the tribe that I am from, I'm from the southwest part of Nigeria. You don't remove your cap and give it to someone. And the teacher just said, no, that's how you do it here. Whatever they need, you have to give it to them. Because they are children with special needs. So I have to remove my cap and put it on her head. And she said, so, yeah, I look like a queen of England. So that is one of the benefits of inclusive education. It promotes social interaction and empathy. You have to feel empathy for those children. It's not that you go for TP and you see a learners with walking disability and you say, you cannot run. Look at the way you are walking. You need to feel empathy because we are going to an inclusive classroom. So another benefit of inclusive education is it enhances communication skill and it reduces discrimination and stigma. You must not say, oh, this one, what happened to you? Why are you closing your eyes and opening it? Can't you see from that place? You have to care for them. So it's going to reduce discrimination. You are not going to say, you cannot sit, or somebody will be saying, I can't sit with that boy. Look at the way he's eating. Look at the way he's doing. No. It's an inclusive classroom. So it reduces discrimination and stigma. And it also encourages collaborative learning. All of them will learn together. Both the children with hearing impairment, with visual impairment, you have to put all of them into consideration. So, and as they have their own benefits, there are also challenges of inclusive education in the country. One of it is inadequate teacher training. Inadequate teacher training. As I'm talking to you now, the only college of special education we have in Nigeria, I think that's the only one in Oyo. And others, you now, is because the reason why you are taking special education is because you are in a specialized institution. So, and for those of us that are teaching you, let me call myself a complete metamorphosis because we started as an NCE student. In our NCE class, is a course on its own. A special education is a course on its own. So just like the way you are taking it now. So one of the challenges of inclusive education is inadequate teacher training. The training you are receiving now, except if you go and work on it, a semester is not enough to take this, except if you are exceptionally brilliant, that you can get almost everything. Then another thing is lack of resources and accessible technology. I talked about Bradley the other time. I talk about hearing aids. There are other hearing aids that you can also, that the children that with hearing impairment can use to communicate. Then another challenge is the large class size. The normal ratio for us in Nigeria is 35:1. One teacher to 35 students. But there are some cases that you get to some classes, you will see like 50 or more than that. Well, I'm proud to tell you that in my own state, I wish it's Ogun State, you can't see such because everything has been streamlined. So you have to put it in order. So, and by the time you go for your teaching practice too, you have to monitor that whatever they put on ground, you have to manage that. So now the next challenge is negative attitude towards disability. Some, they see those learners with learning difficulty as children that are not supposed to be allowed in the school. Those are the challenges of inclusive education. Then poor policy implementation. So those are that. Let me quickly run you through visual impairment and education strategies and the like. So if I go to hearing impairment, we have talked about hearing impairment while we start the class the other time. I said hearing impairment refer to partial or total inability to hear. So if I pick it one after the other now, if I pick hearing impairment simply means it refers to a partial or total inability to hear sound adequately. When they are making sound, or you clap on somebody's ear like this and that person could not hear you, that person is having hearing impairment. You don't call them deaf and dumb, call them learners with hearing impairment. So it refers to partial or total inability to hear sound adequately. It affects communication, language development, learning, and social interaction. So there are different types of hearing impairment. Or let me say, basically, there are 4 types of hearing impairment. The first one is conducive hearing loss. Conducive hearing loss. That is when sound cannot pass effectively through the outer or middle ear. Maybe due to ear infection or wax blockage or injury to the ear or fluid in the middle ear. That is conducive hearing loss. Then we also have sensorial hearing loss. Sensorial hearing loss could be as a result of genetic factor. So maybe that could be damage to the inner ear or auditory nerve, and it can be as a result of genetic factors. It can also be as a result of aging. When somebody is getting old, they will be having that kind of sensory hearing loss. Then exposure to loud noise can also be one of the causes. Some of you that go to club and go and sit beside the DJ or under heavy sound, when you are exposed to loud noise, it can cause sensorial hearing loss. And the third one is the mixed hearing loss. That's a combination of conducive and sensorial hearing loss. While the fourth one is the central hearing loss. What are the causes of all this? I've talked about the causes. The causes of hearing impairment is in 3 categories. We have the prenatal causes, we have the perinatal causes, then we have the postnatal causes. The prenatal causes, that one is before birth. We have the perinatal causes, that is during the birth. Then we have the postnatal cause, that is after birth. So when we talk about the prenatal causes, it could be as a result of maternal infection or drug abuse during pregnancy. When a mother is consuming hard drugs, that child can lose hearing or genetic disorder. Then prenatal causes, that could be during birth. That's during birth. That's why the prenatal cause. It could be birth injuries. While they are taking the delivery, that child can get injured when you are not being delivered by a professional midwifery or a professional nurse. So such child can have a birth injury. Then it will also be as a result of premature birth when that child is not mature or lack of oxygen during delivery. Then the postnatal can be ear infection or accident. Those are the causes of hearing. So let me quickly take you to communication method for learners with hearing impairment, and that's where we will stop it before we look at the revision of some of the courses, the question that I have with me here. So communication method for learners with hearing impairment. There are 3 communication methods. There are 3 ways you can use to communicate with learners with hearing impairment. The first one is through sign language. Through sign language. Or maybe if I have some of my students here, maybe if you look at me very well, if I do like this, what does that mean? What kind of sign language is this? Look at what I'm doing now. What am I saying? If you can hear me, can you hear me? So what does this mean? What am I telling you? Just 1 minute for your response. What am I telling you? Oh, somebody says salute. What am I telling you? Someone says salute. I didn't get others. So what about this? What about this? Oh, someone is saying hello. Yes, you got that. Hello. What about this? What about this? Someone is okay, good. So what about this? Somebody is saying well done. What about this? When I turn it down, what about this? I hope you can see me. What about this? Okay, so those are the 3 ways that you can communicate with learners with hearing impairment. With sign language, that's a visual language using hand sign or facial expression or body movement. The second one is lip reading, lips reading. If I didn't say anything and I just said it. So you as a teacher, you must have those skills, abilities to get the sign language, lips reading, or mix both the lips reading and as well as the as well as the sign language. So what about if I do like this? Can you see me? If I do like this, I put my 2 palms together and I open it. What does that mean? What does that mean? Okay, that's fine. That's all right. So that's all right. That's all right. So I'm thinking of moving to the way of. Okay, we've done inclusive here. Okay, so let's quickly move on to questions and answer now. Let's move on to questions and answer. Are you ready? Or let me give you a few minutes if you have question. If you have question, can you type it in the comment section? Question. Can I have your questions in the comment section before we go to question and answer? Question. You have question? Someone said, sir, the last meets God. I don't understand though. So Lukman, go ahead with your question. Lukman, go ahead with your question. Lukman, go ahead with your question. Oh, the third method of communication. Thank you. Kukoi said the third method of communication. Third method of communication. Is that what you mean? That's total communication. Total communication. Total communication. Can you hear that? That's total communication. The first communication is sign. That is sign. The second one is lips reading. And the third one is total communication. Total communication is a combination of both sign, lips reading, and what is it called? Body movements and the light. So the last communication you did, you did not tell us. Yes, I've just tell you that is a total communication. Total communication simply means you use both sign and lips reading. Use both sign and lips reading. So understanding, that's the combination of sign language, lips reading, gesture, even visual aids. You'll be looking at the face. If a learners with hearing impairment just frown or close his eyes like this and frown to you, you know what it means. So that is such that one is that's a total communication. So that's a total communication. So let's go to questions and answer without wasting much of our time. So are we together? If you are ready for question and answer, can you type yes in the comment section? If you are ready to answer my question, can you type yes? If you are ready for question, can you type yes? Can you type yes? Yes, I can see yes. I can see yes. Let's have it. Yes, yes, I want yes more. I want more yes. I want more yes. I want more yes. Okay, so let's go with the question. Let's go with the question. So the first question is, sign language is mainly used by dash. Sign language is mainly used by dash. So I'll be putting the question. I'll just say number one. Just tell me the answer. Sign language is mainly used by dash. Sign language is mainly used by dash. Sign language is mainly used by dash. Answer. That's question number one. Sign language is mainly used by dash. No option, no. No option, no. It's mainly used by hearing impairment. Sign language is mainly used by dash. Sign language is mainly used by learners with hearing impairment. Okay, so number two, lips reading involves dash. Lips reading involves dash. Lips reading involves dash. Two, lips reading involves dash. Okay, maybe I should just help you to do it in that way. Okay, lips reading involves dash. Lips reading involves dash. Lips reading involves dash. Somebody said lips reading involves dash. What does lips reading involve? Lips readings involve dash. Let me get an answer from you. Lips reading involve dash. Some people are just typing lips reading involve dash. Learners with hearing impairment. No. Lips reading involve dash. What does it involve? Lips reading, what does it involve? It involves observing facial and lips movement. Lips reading involves observing facial and lips movement. So you are going to look at the facial expression of that person and lips movement. Okay. The next question is total communication combined dash. Total communication combined dash. That's number 3. Total communication combined dash. What is total communication? What is total communication? What is total communication? What is total communication? What does it entails? What does total communication entails? So I'm waiting for you. What does total communication entails? Okay, both sign language, lips reading, body movement. Yes, that's correct. Involve all communication all together. What and what communication? What and what communication? Total communication involve the combine of both sign language and lips reading. Or you say sign language and other words and other hearing impairment communication. Okay, so that's number 3. So let me go to question 4. Question 4 will involve me giving you option now. Which teaching strategy is appropriate for learners with hearing impairment? Which teaching strategies is appropriate for learners with hearing impairment? Speaking while facing the board. 2, avoid visual aids. 3, using visual instructional material. 4, ignoring classroom noise. Which teaching strategy is appropriate for learners with hearing impairment? That's number 4 question. Unfortunately, those that are not here, it's not possible for you to see this again. So that's number 4. Which teaching strategy is appropriate for learners with hearing impairment? Oh, somebody said 3. Oh, that's good. Someone said 3. So what is 3? 3 is using visual instructional material. So number 5, one major effect of hearing impairment is difficult in dash. That's number 5. One major effect of hearing impairment is dash. 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 One major effect of hearing impairment is difficult in dash. Is difficult in eating, communication, walking, sleeping. Which one is the correct answer? Okay, good. That's communication. Now let's come to that question. That question. I say that question because I know some of you have to go and learn that very well. So just listen attentively and tell me what it means. So question number 6. Is that 6? Is that 6 now? Is that 6? So question number 6. So can you tell me this? A person placed the finger. Okay, thank you, Ilesami. A person placed the fingertips. A person placed fingertips. A person placed fingertips. Look at this. A person placed fingertips of the dominant hand on the chain and moved the hand forward slightly. What is that person saying? What is that person saying? What is that person saying? What's that person saying? What is that person saying? A person placed the fingertips of the dominant hand on the chain. Okay, somebody said thank you. All right, let's move to the next question. A person placed an open hand on the chest and move it in a circular motion. What's that person saying? See this one again. See this one again. What's that person saying? What's that person saying? What's that person saying? Oh, someone said all together. Someone said all together. A person places an open hand on the chest and move it in a circular motion. It means that person is telling you, please. It means please. It means please. So let's see the next one. Let's see the next one. A person raised one hand and wave it from side to side. A person raised one hand and wave it from one side to side. What is that person saying? Somebody say, calm down. What is that person saying? What is this person saying? Sorry or goodbye. No, it's goodbye. Yes, that person is saying goodbye. So let's see this. Can we see this again? A person points to themselves with the index finger. I asked my student that what is index finger? The first thing is that you must first of all know what does it mean to say index finger. This is your index finger. Yoruba people will call it Ika Ilabe. Yes. Apology to those people that did not understand Yoruba. Ika Ilabe. That's the index finger. That hand you normally use to do your soup. That's the index finger. So when a person points to themselves with the index finger, what does it mean? Okay, somebody said me or hi. Okay, that's good. That's a brilliant one. That's a brilliant one. Can we go to another one? Can we go to another one? Okay, can you try this? What's this person saying? He points the index finger towards one another. Point index fingers towards one another. Point index fingers towards one another. He points the index finger towards another person. Point the index finger towards another person. What's that person saying? You. Thank you, Angela. You. Okay, what about this? What about this? What about this? A person notes the fist up and down as if the head is nodding. What does that mean? What does that mean? What does that mean? What does that mean? Somebody said come. Okay. So what about this? What of this? A person open and close the finger of one hand near the mouth as if he's talking. If I do this, so what is that person saying? What is that person saying? What am I saying? He opened and closed the finger of one hand near the mouth as if he's talking. What does that mean? What does that mean? He wants that person to talk. Just say something. Say something. Okay, what about this? Let me give one more before we move to another subtopic. Okay, let's see this one. Let me see if you can get this one. A person points two fingers toward the eyes and then upward. What does that mean? What does that mean? What does that mean? A person points two fingers toward the eyes and then outward. What does that mean? It means see something. A person points two finger towards the eye, then upward. Look at me. He do like this, as if he want to put the two finger in his eyes and now pointing towards you. It means he's telling you to look at something, look at it, look at something, look or see something. So when you say something, when you see something, you must what? When you say something, when you see something, you must what? When you see something, you must what? You must say something. Not yes. So somebody is saying yes. It's not eyes for eyes. So I can see some people saying eyes for eyes. My eyes on you. Okay. Someone is saying my eyes on you. It means see something. I want you to see something. Now let's come back to this. What is the best way to define special education? Can you define special education in a simple language? Can you define special education in a simple language? In the comment section. Yeah, somebody say something. When you see something, you must say something now. Can you define that in a simple language? I'm waiting. So define it in a simple language. Define special education in a simple language. Somebody is using ChatGPT here. What is special education? Or should I say special education means something? What does it mean? What is special education? Is it education designed only for gifted learners? Education provided to learners with unique learning needs requires support. General education for all learners. Vocational training for adults. What does it mean? What is special education? Okay, that's that. Then the next question is, okay, how can you describe an exceptional learner? Or let me say, what is the best way to describe an exceptional learner? What's the best way to describe an exceptional learner? What's the best way to describe an exceptional learner? Best way to describe an exceptional learner. This is not an issue of go and check ChatGPT. Of course, you already know what it means to say CBT. So let me ask you this one. Special education mainly focus on dash. Special education mainly focus on dash. It focus mainly on what is that? Special education mainly focus on dash. Special education mainly focus on dash. So my plan is to leave by 9:30. We end the class by 9:30, and then like I said, you may not have the opportunity to see the question again. So you can see that we start from so next one now. So can you answer this? Visual impairment appear. What does it appear? Visual impairment. I've gone back. I'm now back to those questions. Visual impairment affects dash. Visual impairment affects dash. Thank you, Adeshina. Visual impairment affects dash. Visual. Visual impairment affects dash. Visual impairment affects dash. It affects seeing ability. It affects seeing ability. Yes, thank you. That person says seeing. It affects seeing ability. Okay, let's move on to the next question. Learners with difficulty in reading may have dash. Learners with difficulty in reading may have dash. Learners with difficulty in reading may have dash. Autism, dyslexia, blindness, deafness. Okay, that's okay. Thank you. Edis got it right. Edis got it right. Oh, okay. Miriam also get it right. Taiwo also get it right. So let's see this one. Hearing impairment can be supported with dash. Hearing impairment can be supported with dash. Hearing impairment can be supported with dash. Somebody says sign language. Hey, hearing impairment can be supported using dash. Hearing aids. Thank you, Akin Ola. Hearing aids. They can be supported with hearing aids. Now, let's see this one. Intellectual disability. Let's go on intellectual disability now. Intellectual disability mainly affects dash. Intellectual disability mainly affects dash. Intellectual disability mainly affects dash. It affects dash. Somebody said brain. Somebody said ability to think. Yes, you are all correct. But yes, somebody said reasoning. But you know, like I said in our last class, that there are three main domains in education. We have the cognitive domain, we have the affective, and we have the psychomotor. Anything that has to do with academics or reasoning, that is cognitive. So intellectual disability mainly affects the cognitive. It mainly affects the cognitive. So cognitive, it mainly affects the cognitive. It mainly affects the cognitive. So don't forget that. Don't forget that. Take note of that. Okay, two more questions to go. Two more questions to go. Cognitive ability. Yes, that's okay. Two more questions to go. Two more questions to go. Conducive hearing loss affects dash. Conducive hearing loss affects dash. Conducive, it affects dash. Conducive. You have to conducive loss. Conducive loss affects dash. It affects dash. Not sando. Not sando. That was what we discussed here. It affects the outer or middle ear. Outer or middle ear. Outer or middle ear. Okay, let's take that one away and move on to Damage to the inner ear may cause dash. Damage to the inner ear may cause dash. Damage to inner ear may cause dash. Yes, outer or middle ear. That one is correct. Damage to the inner ear may cause dash. What can it cause? What can it cause? Damage to the inner ear may cause dash. Receptive skill. It can cause sensorial hearing loss. That was what we treated the other time. Yes, thank you, Akinola. Can you go on this? Sign language is mainly used for dash. I think we treated this the other time. Sign language is mainly used for dash. So I think so far so good. We have been able to touch most of the reasonable part of this course, and I wish all of you best of luck. So any question? I will entertain question for the next 5 minutes before we call it a day. See you tomorrow in the test room. See you tomorrow. Once you see me tomorrow, just wave. No question, no. Just do as if you have hearing impairment. Or you are a learner with hearing impairment. When you see me, you can do like this for me if I deserve this. Or this. So any question before we call it a day. Atathesia. I don't know. What is atathesia? Someone is asking what is atathesia. So any question, if you have any question, you can. Baby, you too, baby. Oh. Baby. Akinola, baby. So, all of you. Autism spectrum disorder. Autism spectrum disorder. That is ASD, autism spectrum disorder. I told you the other time. Maybe you go and listen very well. So if you are just joining or you join late, I will leave this video to tomorrow morning. You can just go and take your time to still watch and listen and practice some of those questions that I've released. Autism spectrum disorder, that's a difficulty in communication. That's somebody is asking about that. That's difficulty in communication. Which one is IEP? What's the full meaning? What is IEP? So if you still have questions, so we call it a day. It's almost 9:30 here, and I want you to go and prepare very well. You have a lot of materials with you. Just try to go through the materials again. If you'd like, you can still come through. You can still go through this video again. Like I promised, I will still leave it for some hours before pulling it down. You can come back and listen to the video and wash and rewash and rewash and rewash again. So I wish all of you best of luck tomorrow, and I'm looking forward to be hearing good news about the test. So bye for now. So if you have any question, you can wait behind and ask. Your eyes is on you. Eye on you. Adesoya Adekunle. Okay. Oh. So you can also share the link with others. Baby, Lukman Oduto, bye you. So you can all go. You can go. You can go. You can go. All right, sweet dream, Islamia. Types of hearing loss. There's no types of, what is types of hearing loss? Miriam, thank you. Akinola, what is types of hearing loss? There are 3 types of learners with hearing now. Talk about somebody. Zainab, when you get there, you know. You know the numbers of questions you have there. So thank you all. So see you. Thanks a lot. We love you, and there's nothing you can do about it. Oh, thank you, thank you, thank you. Amen. God bless you too. I don't mean. So thank you all. You can go. And where I born you. Islamia. So I wish all of you best of luck. I thought Dr. Ibrahim will join before. I was actually waiting for him to join the class so that I can add his voice. But unfortunately, I guess it's in transit. He may likely not join us. So, but we are in this together. There is no material you want to read, Olamide. Just go and take water on that one. So good night. See you guys tomorrow.